Thom Hartmann here with you, and on the line with us is Congressman Mark Pocan, representing the 2nd District of Wisconsin. His website, pocan.house.gov, P-O-C-A-N. You can tweet him at Rep. Mark Pocan or at Mark Pocan. And Congressman, you're still with us?
I am.
Okay, let's. Every single line is full. We got a million questions for you here. So let's start with David in Fort Bragg, California, listening on KNYO. You're on the air with Congressman Pocan, David.
Hi, following up on Interstate Crosscheck, I'm wondering has there been any type of oversight or accountability for that program, for the millions of names that are on there? Has there ever been, for the last election in back in 12? Okay, these are the names that we cut off, and this is the results. I mean, they were or were not trying to do something improper. Anyway, I'm just wondering, is there any type of accountability or some way to just get rid of this?
Yeah, David, I appreciate your question, and I can't say specifically that we often talk about it in the context of what's wrong with the voter suppression laws across the country in the various states, but I don't know if we've ever introduced something specifically to address that. Again, Keith Ellis and I are trying to do it at the 30,000-foot level, but I think that's a great suggestion, that if there is a specific way we can address that, that would be a good measure to make Republicans explain why it's okay to throw people off the ballots who may be completely legal voters, and because that system was so sloppy and let's put it this way, intentionally sloppy, that's their excuse, is sloppiness at best, we should figure out a way to address that. So I appreciate your suggestion on that, but we definitely use that issue as an example of what's wrong with voter suppression.
And just FYI for our listeners who may not know, BBC and Rolling Stone investigative reporter Greg Palast just released a movie, an hour-long documentary specifically about Interstate Crosscheck, where he actually tracked down Chris Kobach and interviewed him and confronted him with these voter lists of largely people of color that he was throwing off their voting rolls and whatnot. It's amazing. It's called The Best Democracy American Money, the Best Democracy Money Can Buy, and it's you can watch it for $3 over at Amazon.com.
And the picnic scene alone is worth the price of the admission, right?
So you're familiar with it? Yes,
yeah.
You're absolutely right. You're absolutely right. Okay, Albert in Los Angeles, listening on Sirius XM. Hey, Albert, you're on the air with Congressman Pocan.
Thank you for taking my call. I have a comment and a question for the congressman. The comment would be around the health care law and why there wasn't a provision in the law that included some type of increase in the supply of health care, meaning maybe we give free tuition to college students trying to get medical degrees or something around that. So the actual fundamentals of economics with this law do not make sense. It is a moral law, can't argue that, but the fundamental economics of it does not make sense. You didn't increase the supply of health care when you put on 20 million people, and of course costs are going to go up because health care it's got an inelastic demand curve, so it's up and down no matter the price.
Congressman?
Yeah, so let me say this, Albert. First of all, I was not here when it was created. This is my third term. I'm just beginning, so I can't tell you specifically if that was an issue that was addressed. I just don't remember from memory since I wasn't here serving at the time. However, I will tell you there is a fallacy out there in a way that there is these huge cost increase for some reason of the Affordable Care Act. We do know that when this law passed, the curve that was going up much higher than inflation largely flattened out. One of the first cracks in that was the pharmaceutical companies, where they did try to have some provisions in there and they were not successful. And the pharmaceutical companies were the first to quite honestly get greedy and increase prices and start to have some of the cost curves go back up. But I can tell you, as someone who was a private sector employer for now 29 years of my life, when I have health insurance for my employees, I often saw 20% plus spikes. And the spikes we're having now are nominal compared to what they were. In fact, in Wisconsin, I have this number right here. We had the average premium for Wisconsin families with employer coverage grew 4% during that period, the 2010 to 2015, compared to 7.4% the previous decade. So a lot of it is a rhetoric of the cost issue, and because there are some additional costs now we've seen, especially because the pharmaceutical companies, that's become an issue. But quite honestly, it's a distraction from the fact that 20 million people now have substantial health coverage who needed it. But I'm not saying that it's not a valid point that we shouldn't make sure that there are more people available in the healthcare field, and ideas like tuition and things like that are great suggestions.
Yeah, it's the classic right-wing Fox News propaganda strategy of basically argument by example, cherry-picking examples and saying, oh, here, look at this one guy. He must be like everybody. Anyway, Jack in Tahlequah, Oklahoma. You're on the air with Congressman Pocan. Jack?
I'd like to ask, yes.
Yeah, you're on the air. I'm sorry.
Hello?
Yeah, go ahead.
Thanks for taking my call. I'd like to ask the representative's opinion of a couple of things. First, President-elect Trump, how do you feel about the way he has set up divesting himself from his business? Are you comfortable with that going over the next 4 years? And
okay, Jack, I'm going to leave it at that because we're doing one question per caller. So, Congressman?
Yeah, first of all, Jack, that is a great question, especially given the I guess the reality show / press conference yesterday we had, that hit kind of new lows, I think, for presidential press conferences. But the fact that the best answer he's going to offer is that he won't take in new business, but he's not going to divest himself. He's not going to put in a blind trust, I think is absolutely unacceptable. And I think it really breaks some new territory. We're going to have to decide for how the president conducts himself. I mean, there's way too many things that can tangentially and directly affect their business, and to have that kind of a response isn't acceptable, and I don't think it's acceptable to members of Congress, and I think at least the Democrats in Congress, and we're going to continue to push that issue, as well as the people who are in charge of ethics here have already said that's completely unacceptable.
Yeah, I would think it would be a national security risk, if nothing else. If a Trump hotel gets shot up in some other part of the world, what happens next? Christopher in Lake Isabella, California. You're on the air with Congressman Pocan.
Yeah, my question, first, thanks for taking my call, longtime listener. My question is in reference to torture and going back to the Bush administration. Nobody was actually indicted or nobody was actually fired, I don't believe, in the CIA or in the intelligence community for that. And what's to ensure us with this new administration coming in that can't happen again or won't happen again or isn't happening again, even though General Mattis is saying that, it'd be better with a cup of coffee and a pack of cigarettes to get information from terrorists. And one other comment I want to make is it seems like every terrorist attack that happens lately, the FBI was aware or the intelligence communities were aware of these people, and yet they're getting through and committing terrorist attacks. And I'd just like to hear your comment on that. Thank you.
Thank you, Christopher. Thanks
Sure,
for listening to 6.
First of all, my general view is just torture begets torture. If we do this, not only is it not humane in any way to try to get the information we need, there are other ways that are proven to be far more effective, but we put other Americans internationally and abroad at risk potentially in the future when we do that. So I can't specifically, because again, I wasn't around during the Bush administration, say I don't remember if anyone I don't believe was indicted or fired. However, that's part of why we did the letter from the Progressive Caucus suggesting that if there's anything that the president can do as he's leaving to make sure that they're not allowed to be able to go back to torture, even if it was just a glib talking point that President-elect Trump said, it has real ramifications on our international relations, and we cannot that's not what this country's about, and it does not serve us well to do that. So we're trying to stop it before he gets in, but we've got a week to do that.
We've got a week to do that. That's a tough one. The first vice chair of the House Progressive Caucus, Congressman Mark Pocan, representing the 2nd District of Wisconsin, is on the line with us taking your calls for the hour. We'll be back with more of your calls for Congressman Pocan right after this.
You're listening to Thom Hartmann. Visit thomhartmann.com for audio and video archive.
And more of your calls for Congressman Pocan. You can tweet him. You can check out his website, Pocan, Pocan.house.gov. And welcome back. James in Duluth, Georgia, watching us on Free Speech TV. You're on the air with Congressman Pocan.
Hey, I'm actually a provider, and the other thing that's... You there?
Yeah.
The other thing that's not talking about is, since Obamacare came into effect, the reimbursement schedules for doctors and providers is just flat-out awful. We're getting reimbursed from 1999 levels. And to answer the other guy's question about why people aren't going to medical school, The pay is just atrocious now in the field unless you go into hospitals. Ray-Bans and Oakleys, which used to be made in the United States and Italy, are now made in China. Dental devices are now made in China. There's a whole other list of things. The reason that veterans are not getting seen on timely fashion is one reason. They do not pay doctors and providers enough to go see them. They actually pay more for people on WellCare than they do for the military, and I think that's an atrocity. Okay. Nobody's addressing that part of it about the low pay to providers, and Chuck Schumer is wrong. Rural hospitals do not want people on Obamacare. They do not pay the claims fairly. They pay maybe wholesale, if that. Thank you.
Thank you, James. Your thoughts on that, Congressman?
I can just take one thing that I would like to extend from the idea on at the VA. We've had some problems in some VA facilities, but in general, including in almost all of them in Wisconsin, you have good quality care. I have a Tea Party uncle in Colorado who, about a year and a half ago, was singing the praises of Trump way back then, which I should have had some foreshadowing. And he was talking about all the things he didn't like about the federal government. At the end, he said, "But leave my VA hospital alone." It's just so interesting when it impacts a conservative. But I do think it's valid to say that we don't treat our federal employees very well who work at the VA because the Republicans have been trying to privatize that system. And when you have those attacks on a continual basis from the Republicans, it's hard to really keep and maintain the respect of the people who work in that system who are just trying to take care of the veterans who served our country, but they're constantly under attack by Republicans who want to privatize that system. And it is a real struggle that we try to deal with in Congress.
So if I could rephrase what you're saying, tell me if I've got this right. The Republicans have, from sequester to everything else, they have been fighting funding for these programs because they want to break them so they can stand there and say, hey, look, it's broken. Let's hand it off to United Healthcare or Cigna. Is that basically the...
Absolutely. This is the classic Republican playbook on many issues, but on this one in particular, I have seen them, they constantly try to, if something's not working in certain parts of the country, they want to make it across the board. If you live so far away, you can take your money to a private firm. The problem, there's multiple problems too that I could spend a long time talking about, but directly the intent is to try to destroy the VA system that we currently have. But if my Tea Party uncle is telling me how great the VA system is and he hates everything else that the federal government does, I think that tells me a lot. And I know people in my district, we do transplants, we do all kinds of really heavy medical procedures that with great success, and they're provided to people through the VA system. It's a good system. It's not going to be a good system if you take away the funding and you continually fight the employees who work there, and that's what the Republicans have been trying to do. So then they can make the argument the VA is not working and you have to privatize it.
Remarkable. Congressman Mark Pocan taking your calls here on the Thom Hartmann Program. We'll be back with more of your calls right after this. Stick around. It's coming up on 11 minutes before the end. Welcome back. Thom Hartmann here with you, and on the line with us, Congressman Mark Pocan, the first vice chair of the House Progressive Caucus, and Congressman from Wisconsin. Pocan, Pocan.house.gov is his website. And Dale in Cary, North Carolina. Listen on Sirius XM. You're on the air with Congressman Pocan. Dale? Dale is apparently not there. Let's try Russell in Cordova, Tennessee. You are on the air with Congressman Pocan.
Hi, Tom, Congressman. I'm very concerned about the president-elect. You mentioned you're concerned about his conflict of interest. Would you be willing to get behind impeachment hearings? And I'm also concerned that he asked Russia for stolen information during the election. That, to me, is impeachable, too.
Okay. Congressman Pocan, your thoughts on that? And also, if we impeach Donald Trump, we end up with Mike Pence, which, frankly, I'm not sure which is worse. Let me just toss that to you.
Yeah, I mean, someone who's completely unpredictable or someone who's one of the most conservative
Hardcore right-wing ideologues.
Yeah, ideologue, and it would take us in a very bad direction. I think we have to watch everything he does very closely, whether it be around the conflicts of interest, because I think that is very significant, and whether it be around some of the issues with the hacking. I'll tell you, right after this, I'm going down to read the classified report that we had on this, because I want to have a little more background myself on it, just for my information. We have a briefing tomorrow for members of Congress as well. I just think that on multiple fronts, we're going to have to be very tenacious in our watching what he does in the checks and balances, because he is so unpredictable. As simple as I just close the Twitter account, President-elect, things like that can cause us so many potential problems. But when there is something that could very likely be impeachable, I think you have to keep every option on the table. But right now, I think we're still in the information gathering to see how far this goes, and we're hoping that maybe he'll come to some senses around the conflicts of interest with his business.
There you go. Joe in Coos Bay, Oregon, listening on KBBR. You're on the air with Congressman Pocan.
Congressman, thank you for your service.
Oh, thank you, Joe.
My question is, I've been a registered Democrat since 1960. In fact, today's my 74th birthday.
Happy birthday.
I was
Happy birthday,
naturally being an old guy who knows better times, was a big Bernie fan. And then, fast forward to the real primaries, I learned the effect of superdelegates, let alone the corruption that occurred. My question to you is, what is the Democratic Party going to do about the superdelegates? They're a big turnoff for me, and I don't think I could ever vote Democrat again, knowing that these superdelegates have so much power.
I hear you, Joe. First of all, happy birthday. My aunt and uncle and cousins growing up lived in North Bend, Oregon, so I know Coos Bay area well. Let me tell you that this is one where we have such a large number of them, and I guess this was in reaction to the election from '72, and I think there might have been an overcorrection. And honestly, there's two issues. One is the superdelegate issue, and I do think that they're looking at, out of the convention, a process to potentially reform it. I think they need to. It's too many people that aren't basing their votes for president at the convention based on what happens in a state, and that's one thing that needs reform. But I think the second thing that we also have to take a look at is every state is significantly different in its process. We have an open primary in Wisconsin. Some states have a caucus. Some states have a very small closed primaries. And that can give you very different results as well. So I think both of those I would like to see looked at by the Democratic Party moving forward. And I think one of the reasons why I and others look to Keith Ellison as someone that we'd like to see lead the party is I think he's more likely to democratize that process because we do need to democratize it, because I think a lot of people were turned off by that. And the last thing we can do right now is lose that support that I think we really saw is out there. We need to build this party from the grassroots, and that means what states do with their voting systems have to matter, although I do want to make sure that we've got some commonality in the voting system.
Kyle in Broken Arrow, Oklahoma. You're on the air with Congressman Pocan.
Yes. Hey, my name is Kyle, and I was wondering, I had a question about the health care, about the repeal, and I was wondering if it's really going to be repealed. I mean, I hope it's not going to be, but I was asking you if they have the votes to do that.
So, Kyle, this is going to be something to watch for months and perhaps for years. They're claiming that they want to repeal it, and now they're kind of claiming they're also going to replace it. I think President Trump said simultaneously, at the exact same time, he's going to replace and repeal it somehow. The problem is they don't have the votes for that on their side. The Tea Party largely wants to repeal it, and that's it. That President-elect Trump and some members of Congress have said they like certain provisions, like pre-existing condition provision and children staying on health care policies, but that costs money, and they're going to repeal all the revenues. It's not an easy thing to do also by how the law is in Congress. They really have to. It's a very tightly woven knot that they're going to have to untangle to do this. Now, having said that, they're going to probably do a very high-profile repeal. They'll probably do some kind of a process to replace, because I don't think they're going to get much farther than that. But my fear is that as they, have some sunset for the program, and they'll have a very difficult time finding a real replacement for 5 years. They haven't. That the insurance companies are going to be questioning whether or not they're going to continue to offer this. The 20 million people who get this are going to be in jeopardy and wondering whether or not they have health insurance. And again, if they can make this more confusing to the insurance companies and the people who have the policies, and then it starts to implode, then they can say, look, see, we told you it wouldn't work, right? It goes back to that same playbook the Republicans do. So I think we'll see a vote that repeals it because they have to, high profile. The replacement's going to be a much more difficult thing, and because of that, you may see a sunset and the program it continues, but it's going to be very unsure in what way it continues.
I have all these examples on Facebook and Twitter of people saying, I want to repeal Obamacare, but I'm on the Affordable Care Act. I like the Affordable Care Act. Yeah. And they don't realize it's the same thing. I'm betting that they're going to repeal and replace it with the exact same program and simply rename it. It'll just be a bait and switch.
Doesn't Trump put his name on everything?
There you go. There you go. Okay, we've got about 1 minute and 45 seconds before the end of the show. Peter in Saratoga Springs, New York. You're on the air with Congressman Pocan.
Hey, Congressman and Tom, thank you very much. I enjoyed the show.
Thank you.
I have insurance under the ACA, and what was very important to me was it allowed me to retire early. So at age 62, I was able to retire. I obtained my insurance. My premium went up 8.9%. And my question is, though, with the repeal, is there any consideration given that if you are 62 and receiving your Social Security, would they give you access to Medicare?
Yeah, we have no idea what they're going to do because they have no idea what they're going to do. My fear is that anything they do around Medicare is not going to be good. It'll only be bad, which is why we're getting ready for a fight on Social Security and Medicare and Medicaid. So I don't know if they're going to make it better. But, your example, I've had people tell me they can now start a business. They could leave the job they had because they could get health insurance and go ahead and start that business. There's so many stories we have. And this Saturday and Sunday, where there's a weekend of action between the House Democrats and Senate Democrats around the country to profile people who would lose health insurance and to talk about the rural hospitals and other hospitals that'll have huge amounts of money they're going to go on to others to pay for if you lose this because people will be coming in uninsured. There's a lot of ramifications, and I think we're just starting to talk about how much trouble it is to repeal that law.
Where can people learn more about this action that the Democrats are doing?
It's going to be just about every Democrat is doing it in their district. On our Facebook page, we are doing at 11 a.m. Central Time. We're doing in Rock County, just outside Janesville, which happens to be where Paul Ryan is from, but it's in my district, a Facebook town hall. So we're going to be having some people who are losing their policies, some health professionals, and we're going to open it up to question and answer. So
cool.
Everyone's welcome.
So check out your congressman's, your Democratic congressman's Facebook page or website, pocan.house.gov here. Congressman Mark Pocan, thanks so much for being with us, sir.
Absolutely, Tom. Thank you.
Great talking with you, as always. Thank you so much. And thank you all for being with us today. It's been a great day. Don't forget, democracy, as our president said, is not a spectator sport. Do you have that?
Because democracy isn't a spectator sport.
So get out there, get active, tag, you're it.